Remember who these words are coming from, folks. Now, what about institutionalising affordable housing? We need that supply transformation. This 39 billion over 10 years, it's frankly not enough. And we're not going to build 1.5 million homes with it. It needs to be fast, it needs to be reliable, and it needs to be decoupled from the political cycle. So, what's the prescription? A new institutional model, leverage of patient capital. A lovely concept, this patient capital, but it is out there. Ultimately, long-term institutional investors are extremely patient, right? Pension funds, sovereign wealth funds, which is an external concept of the sovereign wealth fund, of course. It's not being suggested in the crisis paperwork or the shelter report that's being analysed here. But this is what we need to attract. A purpose-built, regulated, affordable rental sector. Could be facilitated through REITs, real estate investment trusts, similar vehicles. They could offer stable returns in exchange for adhering to affordable rent caps and long-term security of tenure. Focus on housing outcomes, not just units, right? The institutional approach must prioritise the creation of stable, supported housing, recognising that housing outcomes are deeply linked to complex needs. Research conducted through programmes like the systems-wide evaluation of homelessness and rough sleeping highlights the importance of supported housing and its interaction with the wider system, noting challenges like declining provision and fragmented funding. The new model must provide secure funding and standardised quality for this critical supported stock. Prevention mandates then, from collaboration to accountable outcomes, and this proposed duty to collaborate once again. So public bodies have got to work together to prevent homelessness. Remember, prisons, hospitals, social care. It's a welcome shift, right? It seeks to end the needless homelessness that results from people leaving public institutions. They are seeing this, folks, as the low-hanging fruit. Collaboration without consequence, though, is simply bureaucracy. So they need to tie funding to measurable outcomes. This DTC has got to transition from a general duty to refer into a prevention mandate with quantifiable targets. The current national plan sets specific goals: halve the number of people who become homeless on their first night out of prison, and ensuring no eligible person is discharged to the street after a hospital stay. What about financial accountability? Well, local authorities receiving the homelessness prevention grant and other related funding have got to demonstrate progress against specific measurable outcomes, right? Failure by partner agencies to meet DTC targets, if the prison system miss it or the health trusts miss it, there must be corrective action. There must be a reallocation of targeted prevention funds. This mirrors the systems-wide evaluation research, which explores the drivers of homelessness and identifies where interventions can have the greatest impact. A failure to enforce accountability simply sustains the current pattern where the taxpayer is paying the price of failure while the crisis accelerates.